breast cancer?
Well, breast cancer in the earlier stages may not have any signs. That's why we always recommend women to go for breast screening, especially when they are age 40 and above. But as the cancer enlarges, signs and symptoms will then appear. For example, there could be a new lump in the breast, especially in the breast area or the armpit area. There could be thickening or swelling of part of the breast. There could be irritation and dimpling of the skin over the breast. There could be redness and flaking of the skin in the nipple areola area of the breast. And finally, there could be bloody nipple discharge. These are some of the more important signs and symptoms of breast cancer.
What are the risk factors for the breast cancer?
Well, there are several risk factors for breast cancer, and some of the more important ones are as follows. First of all, getting older. Breast cancer is a disease that affects older women, usually between the ages of 40 to 60. So that's when we want to do breast screening for them. Then there is the risk factor of family history. If the patient has a mother, a sister, or a daughter with breast cancer, the risks are higher. Related to this factor is the genetic mutation risk factor. There is a gene mutation, and we call it the BRCA1 or BRCA2 gene. If you have this gene, the chance of having breast cancer during your lifetime is almost 100%. So that's why this particular group of patients have to be very carefully looked after. The third risk factor that we can consider is the reproductive history of the lady. By this, we mean the period of exposure to female hormones. So if she has early menstruation, that means she has a menstruation at a very early age, we call it the menarche. And she has a very late menopause. She has a long period of exposure to female hormones. Even worse if she has got no pregnancy in between. So ladies who have not delivered any children also will have come under this category of reproductive history risk. Then the next risk factor we can consider is dense breast. Women with very glandular and very heavy breasts have a higher risk than women who have more fatty tissue in their breast. Another risk factor that's important is the risk factor of past history of having breast cancer. A woman who has had breast cancer in one breast has a 10% chance during her lifetime of getting breast cancer in the other breast. So they have to be closely monitored as well. Finally, there's a risk factor called radiation treatment. If the lady has had radiation to the chest area, say 20 to 30 years ago, for some other condition, for example, to treat lymphoma of the chest wall or internally, then she has a chance of getting breast cancer during the subsequent 30 years of her lifetime.
When is biopsy will be recommended?
Your breast surgeon may recommend a breast biopsy if you or your doctor feels a lump or thickening in your breast and your doctor suspects breast cancer. It can also be carried out if your mammogram shows a suspicious area or your ultrasound scan of your breast reveals a suspicious finding. It can also be carried out if your breast MRI reveals a suspicious finding. Finally, it will be carried out if you have unusual nipple or areola changes, including crusting, scaling, dimpling of skin, or bloody nipple discharge.
What are the types of biopsy?
Well, there are several ways we can do a biopsy for a suspicious breast lump. The first and simplest way is called a fine needle aspiration biopsy. This is a method where we use a small needle to pierce the tumor and then aspirate or suck out some of the cells. The cells will then be smeared onto a glass slide and then sent to the lab for analysis. We call this cytology. The second way of doing a breast biopsy is to use a bigger needle. We call it a core needle biopsy. In this technique, under local anesthetic, a slightly larger needle is inserted into the breast lump, and then a strip of tissue or several strips of tissue are removed and then examined under the microscope in the lab as well. The third way that biopsy can be carried out is called stereotactic biopsy, in which a mammogram is used to assist the doctor to pinpoint the location of the suspicious lesion, usually something seen on mammogram, and then biopsies are taken and sent for analysis. The last and final way is the most invasive way, and we call it surgical open biopsy. In this method, the lump is actually excised completely or removed partially. We also have a technique of hook wire localization where a stereotactic method is used prior to the surgical procedure, and a hook wire is placed using the stereotactic method to locate the lump and pinpoint it exactly for the surgeon, who will then follow the wire and remove the lump completely for examination. So these are the general methods of doing a breast biopsy, and your surgeon will choose the best method that is appropriate for your situation.
What are the type of breast surgery?
Well, breast cancer surgery is one of the most important components of breast cancer treatment. And this usually involves the removal of the breast cancer, or sometimes removal of the whole breast, including the breast cancer. And this can be combined with other modalities of treatment. For example, chemotherapy, hormonal therapy, targeted therapy, and radiation therapy. For ladies with a very high risk of breast cancer, for example those with the BRCA1 gene mutation, which gives them a very high risk of getting breast cancer during their lifetime, then breast cancer surgery in the form of prophylactic mastectomy, in other words removal of the breast even before the cancer starts, is one way of reducing their future risk of breast cancer. Now, breast cancer surgeries include the following. Firstly, it could be a simple operation called the lumpectomy, where the breast cancer tumor is removed with a margin of normal tissue around it. This method usually results in very little deformity to the breast, but the patient needs to undergo adjuvant radiotherapy after the surgery is done. The next method of treatment of breast cancer is called the mastectomy procedure. Here, the total removal of the breast is carried out, sometimes with or sometimes without removal of the overlying skin and the nipple. This method is usually carried out if the breast cancer size is large in comparison to the breast. It can also be carried out if there are multiple areas of breast cancer. We call it multifocal breast cancer. Now, together with lumpectomy and mastectomy, a surgical procedure known as the sentinel lymph node biopsy is often carried out as well. The sentinel lymph node is the first lymph node that the breast cancer will spread to. And usually we have a test called sentinel lymph node biopsy. A special blue dye is used to identify this particular lymph node to facilitate its identification and removal. If this lymph node is free of breast cancer, then we do not need to remove the other external lymph nodes. Finally, there is the procedure called breast reconstruction surgery. This is a procedure where the surgeon will try and reconstruct the breast that was removed during the mastectomy. We can use artificial breast implants, we can use patient's own tissues for this purpose. Your surgeon will discuss with you the need for such a procedure and the various techniques that are available to carry this out.